for COVID, which was positive. And he was treated with medicines. But over a week's period, he became breathless, he had severe breathing difficulty, he was put on oxygen, then non-invasive ventilation, what we call BiPAP. But however, all these measures, his oxygen saturation became low. So the doctors treating him put him on ventilatory support. But in spite of putting him on ventilatory support, his oxygen saturation started coming down. That is the time the doctors treating him contacted MGM hospital. So Dr. Apar Jindal, our pulmonologist, went to Ranchi and assessed the minister, and he found him to be very critical. So he immediately alerted our ECMO team. So the ECMO team from MGM went to Ranchi and put the minister on veno-venous ECMO. Now what is veno-venous ECMO? Usually the impure blood or blood without oxygen will go to the lungs, gets its oxygen from the lung, and it is pumped back into the body. Since the lung was not functioning properly, so we drained venous blood out of the body. It was oxygenated by what is called oxygenator, or you can call it artificial lung. Then it is pumped back into the heart, so which in turn will pump the blood into the body. Again, he was COVID positive, so we have to airlift in an isolation pod. So he came to MGM hospital on ECMO support in an isolation pod in an air ambulance. So when he came here, his X-ray was white out, what we call white out. He was on ECMO, there was no oxygenation taking place by the lungs. And we also did the CT, which showed fibrosis of the lung. There was a lot of honeycombing of the lung. So it was a totally destroyed lung. So we continued the ECMO support for a month, and during first week of ECMO support, he was unconscious. He had several episodes of infection and also fall in blood pressure. However, we could manage him, and finally we decided to do a bilateral lung transplantation with him. And to his good luck, we got a suitable donor lung also. The bilateral lung transplantation was done on 10th of November by Dr. K.R. Balakrishnan and our team, and it was successful. So we could take off the ECMO on the operating table itself, because the transplanted lungs were functioning normally. So we shifted him to ICU. The very next day we could take off the ventilator, and he started breathing spontaneously. So usually the lung transplantation is done with a transverse incision on the chest. This is the lung being transplanted on the left side. So we do both the lung transplants one after the other. This is the schematic diagram of lung transplantation. We have to connect the bronchus, which actually is a part of the airway, then pulmonary artery, then the pulmonary vein. So this is part of the lung transplantation. Once the lung transplantation is over, we need to do the bronchoscopy to see that the anastomosis, everything is perfect. So this is the explanted lung. You can see the lung which is totally destroyed. So no way it can recover or it can oxygenate the blood. We also did the microscopic study of the explanted lung, which showed multiple hemorrhages, all the neutrophil infiltration, or what we call white blood cell infiltration. We also see fibrosis and totally destroyed lung cells. We also did the electron microscopic study, which showed complete destruction of the alveolar cells.